Yes. It was just. It was only on, that's why we have, you know,
Yeah. Well, yeah, but and this target.
And I think there was something
It was still the same idea, something in terms of, the concept is the same, right?
Hello, everyone.
We're on.
I don't think, I just wanted money, they didn't.
It doesn't require. So.
Okay, 20 minutes? Yeah.
Definitely for 5 down here.
Okay, as long as you started, we'll see if we work on.
Yeah, let's see, so. You're welcome.
Sorry, I could hurry you. Good, yours?
Good, great. Yeah. Good one?
Yeah.
Councilor Joyce, you made it.
did.
Good, thank you.
It's good.
Your twins intact?
Yeah, not yet. They're getting.
Oh,
They are. A long story.
Perfect. The other two are busy, but it's like. My parents designed their activity system. So they do swimming lessons.
Yeah. And it's.
So I can not swimming by like. So they're on that I didn't really know. No, 100%. Like, just call it something else.
Yeah.
Yeah.
And I.
Social activities.
It's a big yard. Yeah, I like to. But we're doing that. But yeah, and yes.
I think the sweet spot is trying to figure out, get the guy.
They hug. Okay, see the phone.
This, I mean, this is, yeah.
Wilson.
Oh, Pete.
Yeah.
Okay, so John, what did you do this?
Oh,
There.
Ran over and quickly. Say.
I'm just giving John a hard time.
I guess you had to move up from the office because the started smelling.
All right, are we all set? All right, I'm gonna welcome you to our April 15th meeting of the Lakeland Public Health here in Fort Hope. Thank you all for taking the time to come today and the wet spring weather we're having. I'm gonna I'm gonna do the land acknowledgement first, and then I'm going to call the meeting to order. Councilor Joyce has accepted that for next meeting. And I will do it today.
Would you like me to do it now?
You could do it if you like.
Sure.
Yeah. Real one for you.
Yeah, read it. Man, it's. So before I start, I will say, an indigenous friend of mine said, when you do a land acknowledgement, you can't just read it. You have to have meaning behind it. So, as I read this, I really do mean it. No, seriously, we really leaned into that piece and it makes sense. So, Lakeland's Public Health acknowledges that we are gathered on the traditional Treaty 20 territory, the lands of the Mississauga Anishinaabe, including the Mississauga, the Scugog Island First Nation, Hiawatha First Nation, and Curve Lake First Nation, as well as the Williams Treaties First Nations. We recognize these lands as the enduring home of many Indigenous peoples, past and present, who have cared for them since time immemorial. As the season turns to spring, we reflect on its deep significance with Indigenous knowledge systems. Spring is a time of renewal, rebirth, and responsibility, a period when the land awakens, the waters begin to flow freely again, and plants and medicines return. It is a time for planting, gathering, and reconnecting with visions of the natural world. For many Indigenous communities, spring carries teachings about balance, reciprocity, and respect for all living beings. We honor these teachings and the ongoing relationships Indigenous peoples maintain with land, waters, and all of creation. We're reminded of our shared responsibility to care for this place, to learn from Indigenous stewardship, and walk forward in the spirit of respect, gratitude, and reconciliation here on Turtle Island.
Okay. Thank you, Counselor. All right, I'm going to call the meeting to order. And I have a motion declaration of pecuniary first. Are there any declarations of pecuniary interest on anything on the agenda? Okay, hearing none, we'll move to the adoption of the agenda. Are there any amendments to the agenda? Any additions, corrections? Hearing none, can I get a motion to approve the agenda as circulated? Mr. Maloney, Councillor Ryal, all those in favor? These hands, thank you. All right, so item 4 is the adoption of our regular minutes. The minutes of the previous meeting, it's actually February 18th. Is that corrected on in the main one? Okay, in the new one, okay. They've been circulated prior to the meeting. Any additions, corrections? No, seeing none, can I have a motion to approve the February 18 minutes? And I see Councilor Lachika and Dr. Ramesh Mikicha, yeah. All those in favor? Thank you. All right, business arising. Is there any business arising from the minutes? Anybody wants to bring forward? All right, seeing none, we'll move to our medical officers updates. Dr. Pickett.
Great, good evening, everyone. Happy spring. Thanks for being here this evening. So I have a few updates that I'll give today. We've been, Lakeland's and our team's been moving great work forward in the last few months. And a lot of the work relates obviously to the continued merger and bringing teams together. We still await the final verdict and outcome of the East-LERTA process to bring our staff and unions together. And so that is sometimes a challenge. But nonetheless, I think staff are doing a great job of collaborating and learning from each other, how things have been done in each relative jurisdiction and bringing it forward. So a few events in the last month worth highlighting. We had a launch for the Youth Substance Use Prevention Program, which is a pilot program that over 2 rounds of funding, Lakeland's Public Health received nearly $1 million from the Government of Canada, Public Health Agency of Canada, to pilot a program adapted from the Icelandic prevention model on substance use prevention at several schools in the Peterborough region. And we have staff from all over Lakeland's region participating to learn about the program and process. It involves rigorous data collection so that we can look at the specific localized needs and follow up after the intervention to look at the impact. It also involves community collaboration. And there's an advisory table that's meeting and has a number of organizations represented to try to wrap our arms around youth in the community to really change the trajectory and make sure they have the supports they need in order to prevent substance use related harms and challenges later. So a couple of weeks ago, we had the launch for that event with MP Emma Harrison at the event, and a great, I think, kickoff for the project, which has been ongoing for the last year, but really is entering its more engaging phase with schools, with youth, and with the public. In difficult news in the last month, we learned provincially that the province would be finishing funding for the consumption and treatment sites, and in our region, there was one affected in Peterborough. It was one of about 9 remaining consumption and treatment sites in the province that were provincially funded. Funding for that site in Peterborough at 220 Simcoe Street, which is operated by Addictions Treatment Agency Forecast, started about 3 years ago. And they've been doing great work to help to be a welcoming door, to help to support individuals wherever they're at in their journey with substance use, and through safe consumption and other services, really help to try to keep people alive, prevent deaths, and also be a doorway in to directing them onwards to future help and treatment and supports other social supports. There was a lot of primary care related supports that help to keep people out of the emergency departments. And so I think this is all great work that the teams have been doing there. And I want to thank Forecast and the staff at that site that have been doing really important work. Ron wears a hat there as well, and he may want to add a few pieces around that, but I will just say thanks to the staff of that site that have been really doing life-saving work over the last little while. The site closure is scheduled for June, and I do think that that will result in community impacts, both in deaths from the drug poisoning crisis, but also in the visibility of the crisis and challenge when people who were there are now pushed to the streets or to the library or to other community areas where they can't receive that support. I do think as we think about the drug poisoning crisis that's been ongoing for a couple of decades, there have been areas of progress, but in a lot of ways, we really haven't been able to turn the tide on the challenges. And from a public health standpoint, as much as this site, I think, did really great, important work, we need to delve deeper into the root causes of substance use and the trauma and early years adversity that leads to the challenges that we see with the crisis in our communities. And so really trying to help and pull our teams together and collaborate with community partners, the local drug strategies and other agencies to really help to pave a way forward in addressing the crisis, because I do think we need to do more. And I do think this closure is a loss for.
Sure. Before we move on, thanks for that, Dr. Piggott. Yeah, I chair the board Forecast as well. And, Forecast has done a lot of great work in the community. We've had great support from the province as well. We've opened up a new detox and rehab center. Forecast is also the Heart Hub funding organization that's going to open the Heart Hub in Peterborough. And, the loss of the CTS, I know there's individuals out there that don't support the CTS from a social perspective, I guess. But one of the big impacts will be those folks will be back on the street. And for the folks that from the Peterborough area, what the streets of downtown Peterborough look like before the CTS is nothing like what it is today. It's quite a bit of a difference. You don't see stories in the newspaper anymore. You don't see people the same way. So it's going to have an impact on that. Those folks, as Dr. Piggott says, will go to the street now. There was agreements with EMS to post-recovery bring them to the CTS instead of the hospital for emerge visits. So the number of emerge visits will increase. I won't go any more on it, but there's a good research project the last 12 months when the first round of CTS is closed in Ontario. There's some significant research being done on the increase in overdose deaths, increase in emerge visits, all of those sorts of things to look at. So whether you agree with it from a social perspective or not, there's a cost both in human lives and cost in dollars to the health system by taking it away. So it certainly was a very well-run CTS in Peterborough. Dr. Piggott said there was many more things going on there other than safe injection. It was a gateway to getting those folks to rehab and getting those folks to detox. And unfortunately that's lost. The Heart Hub will pick up some of those things, but it won't pick up all of them. So we're hoping that we can continue working with the province to, because they funded it all. They funded the detox and the rehab and the Heart Hub. So they're putting dollars into it. It's just, we think this is a bit of a step backwards as forecast, and I think for public health purposes. So I'll leave it at that.
Thanks. Would you mind just a couple quick other pieces and then questions?
Sure,
if you want?
sure.
Yeah, just very briefly. So at an advocacy level, we're continuing work with other emerging health units across the province to collaborate and message to the provincial government about some of our future financial needs. The mergers obviously brought two organizations together, and with changes including the harmonization of wages, we're anticipating a deficit into next year that needs to be addressed, trying to collectively advocate. We're going to be meeting with the province, provincial government, and staff. We're going to be planning towards a delegation at the AMO conference, and we'll plan to have some more dialogue with the Board of Health probably in June around approaches and strategy to advocacy for the good work we're doing. Also in the fall, some of you may know, will be a municipal election. Lakeland's Public Health will look to organize a educational session about what public health is for any potential candidates in the region, and be able to educate on public health and answer any questions that candidates may have. So we'll look to organize that sometime during the early period in the fall. I will just ask you, Alita, to share our new signage in case you haven't seen it out front on your way in or in any of the other sites. We've got some beautiful signage coming up. And thanks to our comms team that have been working hard away at that, making sure we get the logo, the brand out so that the whole community knows. And part of that journey is also the town halls that we're doing. So we had our first town hall last night in Halliburton. We had about 17 individuals from the community come, which I think is a great success, given a state of emergency for flooding was announced, and we were right by the Gull River last night when we met. So big thank you to all those from the public that came out and all of our staff that were there. There was some great dialogue, great conversations, great relationships built. I'm hoping for more as we continue tonight at 7 p.m. at Office Links here in Port Hope is the next town hall. And on the 20th of May in the city of Port Lakes in Lindsay, and on the 26th of May in Peterborough, as well as sessions being scheduled virtually specifically focused on the urban Indigenous populations, as well as town hall sessions being scheduled in Alderville First Nation, Curve Lake First Nation, Hiawatha First Nation. So,
It was up, so.
great.
Well, we have. Yeah.
Okay.
Yeah.
I just was speaking,
Yeah.
so, we will just share a video, that will, share some more information about the town halls. But maybe before we share that video, I'll just pause in case there's any other questions on any of, my presentation or those items.
Just going back then to, you had mentioned a study that's happening.
Mhm.
Can we get some
Yeah,
information?
we can circulate, there's a internal report that I saw.
Yeah. So, yes, our CEO, that forecast, that, Donna Rogers, is actually having a meeting with stakeholders, sometime this week, I think it is, to talk about what potential impact is gonna be. So, EMS will be there, police, VON, the different agencies that are involved in managing, CTS, to try and again, get ahead of the curve. It will probably close, sooner than June 8th, I think is the official date, but as we lose staff, as they know they're looking for other jobs, we may have to reduce hours, those sorts of things as well. But, the study I think is publicly available. Yeah.
That's great. And then just another follow-up, and you talked about how some of the new heart hubs are gonna take over some of the work that was done. Can we get a clear sense of where the distinction is and where the overlap is, just so that we're all on the same page?
Yeah. The Heart Hub, I don't know that, every Heart Hub's a little different based on the needs of the community and how they presented the proposal to the province for funding. What won't happen in the Heart Hub is harm reduction. It'll be mostly around, housing, transitional housing. In Peterborough, they have the temporary housing, array at Wolf Street. So they'll be located at Wolf Street, and a good part of it will be trying to move those folks into transitional housing to get more homeless people off the streets and into those temporary housings. Obviously, all the referrals around addictions, treatment, detox, rehab, all those connections. And then they will also have, when the clients are housed, there'll be coordinators that are constantly working with them to try and keep them housed in transitional and then move them to more permanent housing. So that's one of the big pieces that the province has recognized is missing. You can't move anybody into treatment or therapy or anything unless they're housed. If they're living on the street, we have no chance of making any kind of improvement. So the focus of Heart Hub is get people housed and get them into treatment. So heart is homelessness, addictions, recovery and treatment programs. So the piece that is missing is the harm reduction piece that the CTS had part of already.
Not to be sticker on this point, but my understanding is harm reduction has a number of different pillars.
Yeah.
Only one of them is actually safe consumption, and so I think we have
Yeah.
to stay really clear around when we say no harm reduction, is it truly no harm reduction, or is it just one element of harm reduction? A critical, important one that's not happening.
Yeah, I think harm reduction, is really two pieces that I see, is one is exactly the safe injection, but the other one is providing, clean supplies, that sort of thing, and counseling. Counseling will still be there, obviously, but, I believe there won't be, you won't be allowed to do injection, you won't be allowed to share, safe supply. Yeah, go ahead, yeah.
Through you, Chair. I think it's a great point. And I think the point that you also raises some concern around the language of the province is used that has explicitly been that there won't be any harm reduction in the Heart Hub site. In addition to safe consumption, which is not just injection, but possibly oral, intranasal, inhalational, which has never been back to these CPSs because of the HVAC related implications in some of the legislation. There is also a needle exchange, which public health has been involved in for more than 4 or 5 decades because of concerns around HIV and hepatitis C transmission. And the Heart Hub specifically won't have that function, which I think is a challenge because we may see more transmission of infectious diseases like HIV and hepatitis C as a result of needle reuse. There's also naloxone, there's spotting. There are a number of other harm reduction related interventions that I think form an important component. And I know certainly in the public and politically, the wording of harm reduction has gotten some negative attention recently, but I think at a basic level, it's part of a 4-pillar approach to the response to the drug poisoning crisis. 4 pillars being prevention, harm reduction, treatment, and community safety. All of those continue to be important in different ways, and I do think in our full region, and I know our manager and director responsible are doing some work to connect with partners and regroup. We do need to have some visioning and an idea of how we move forward because this is, like you say, I think very well, Chair Black, a step backwards, but also, it was not a silver bullet and it was servicing a small client group in one of our communities in the region. In rural areas, were never serviced by that site unless they were there and came in. So I do think that there's an opportunity to have a big picture discussion and work to advance a public health response to the drug crisis.
Thank you. Councillor Joyce and then Councillor Rao.
To you, Chair. Thank you, Dr. Piggott. 2 questions. Comment, 2 questions are together really. You raised 2 terms that are not familiar with, naloxone and spotting.
Naloxone. So naloxone.
Oh, naloxone. I said no lock zone. I thought you said. I know what naloxone is.
Treatment, yeah.
So what's the spotting?
Well, spotting, there's various services by phone, by app, or in person where somebody could tell someone that they're using substances so that they're able to either respond, administer naloxone, or call 911. And there are virtual and online and or phone-based spotting programs that are out there, which is really important. It's in line with the public health messaging, never to use alone. But unfortunately, we know many people, and this is part of the challenge with the CTS, many people don't come out and come to a public location. They're using substances in the privacy of their own home or location, and using alone can be quite dangerous without inconsistent talks of the drugs.
Yeah, so the other thing is the way, expert, but this Heart Hub, I imagine in the transitional housing, you're not allowed to use drugs when you're in the transition. Am I correct in that? So the addicted individual is not going to go there because they're, well, I can't use, I'm not, gotta stay on the street. I mean, that's how I'm, if
And
I'm the addicted,
yeah,
I'm an addict and I go, well,
clearly.
I can't go there, I have to stay, I have no choice.
So clearly, I think the provincial goal is treatment. So I think you'd be right. And this has been a challenge and
But
it's
you
very
can't- sorry to
nuanced.
interrupt, but you can't get treatment to your house.
Right, and this has been challenging with some of the shelter approaches, and some shelters are very different with the approaches. Sometimes a lower barrier language is used, and I think it highlights the need for many doors for many parts of people's journey, wherever they are at that journey. And also different solutions, especially at a housing standpoint, because I think you're very very much right that this won't meet many people's needs and won't help some of the people that are most visibly suffering.
So you agree that this is
Yeah.
a big barrier?
Yeah.
Yeah.
If I could just add to that, Dr. Piggott, the Heart Hub will help direct people to rehab and treatment, that we have in Beaver now, the Detox Rehab Center. You're there, you're housed there for 6 weeks, for rehab. And then we have transitional housing that they can move to. So they're not moving back into the same situation, again, trying and follow up and all those sorts of things. So you're right. I mean, it's not gonna be hundreds that go through the program all at once, but it's only a 6-bed rehab.
Yeah.
But it's a start, you know, and I gotta repeat that the province has sunk significant dollars into mental health and addictions in Peterborough. We don't agree with the CTS closure, but that's only a small component of the bigger picture that Dr. Piggott has spoken to. They have funded successfully the detox and rehab, which we've never had in Peterborough. And the Heart Hub funding over $6 million, I think it is. So there's lots of work to be done, and it's not easy to do it for sure. Councillor Rao?
I'm just gonna change the subject completely. It's in relation to yesterday's meeting. I did, like, of the people who showed, there were 4 or 5 elected officials, not counting myself. And, the compliments that I got back were, and I think they weren't compliments, they were just factual information. One, statistics were presented, but they were presented in English that related to what was going on in our particular neck of the woods and they could relate to. So it wasn't just a whole pile of stuff that came out, it was stuff that could be used and so on and so forth. So that was extremely positive, and this came from the elected officials, which led to what you were talking about before, the ability to probably Zoom, which would probably be the best way, to zoom into our meetings. We have, unfortunately, well, we have 5 of them, sometime between now and prior to the election, and just bring our councils up to speed on where we're going. Can it be done post August? It doesn't really matter as long as we get something to report back to them. And the last thing that they brought up was we had 17, 20 people there. Weather was all wrong. Everything didn't work well. The Goldberger decided to do something really goofy. And so what we were hoping to be able to do, and they'd asked me if we could do, is could we schedule one in late August? Why? Because the population of Halbert County is slightly less than 20,000 this time of the year. When we get to August, it'll be 41 to 42,000. And those are not transient people. These are the cottage people who stay up. And I think that they would be really great. But not only that, in the opinion of the councillors that I've been speaking to, they would not only bring value to our county, but they would take it home to where their permanent homes are, because healthcare is healthcare, regardless of where it is. And so if we bring it up to discuss and they can interact directly with Dr. Piggott and staff, they can take that home and sell it to wherever they come from, as well as within their own neighborhood. So all I can say is thank you very much. Great job. Thank you.
Thanks, Steve. Thanks, Laura. And Steve did a great job representing us, welcoming everybody to the meeting last night. So thanks again for that. Anybody online?
We have the video still that they're consulting with them.
Okay, that's any hands waiting. Okay, we're gonna show the video.
Be a repeat if you were there last night or if you're gonna be there this evening, but just share it for the live stream as well. The projector's gone on.
Just while I switch tabs.
Just overheated a bit.
Oh, it's powered, it's just muted, right?
Was it? Okay.
Yeah.
You may not know it, but public health is all around you. We often talk about public health in 2 branches, health protection and health promotion. Health protection works to prevent harms like infectious diseases, environmental hazards, or chemical harms. Think of the inspections we do at restaurants or retirement homes. Contact tracing of infectious diseases and sexual health we improve through our clinics. Health promotion focuses on improving the health of communities through education and advocacy for policy changes that will make it easier to live a healthier life. Things like smoke-free spaces or education on preventing heat stroke during hot weather. Public health touches every stage of your life, from before you were born through childhood, adulthood, and into older age. Lakeland's Public Health is there for you.
Investing in the early years is so important. Positive interactions during this time period creates this great foundation for children to grow into healthy adults. Caring for children can be a challenging and rewarding experience. Lakeland's Public Health is here to support families who are new to the community, might need extra support to create safe and nurturing environments for their children, or families that just identify they need additional support at this time. It is so rewarding that they can recognize the strength within themselves to move forward. Healthy Babies, Healthy Children is a free, client-focused program that supports families from prenatal period to school age.
I've been supported by Healthy Babies, Healthy Children for about 2 years now. They help you build confidence. Their support is unmatched. Access to resources and people that actually want to help you succeed. It makes a huge difference.
I am so proud to be a member of this community and a nurse at Lakeland's Public Health.
Living here in Peterborough, I'm proud to be a parent and a dietitian with Lakeland's Public Health. Improving access to nourishing food is a big part of what I do. A well-nourished child who has access to balanced meals and snacks that include vegetables and fruit, proteins and whole grains is more likely to have a great day of learning, playing, and socializing. Think about school nutrition policy and curriculum support. We're there. School food programs feed hungry students. Cooking activities in the classroom and in the community help kids build confidence in the kitchen as well as learn valuable food skills for life. As well, nutrition information and tips for caregivers and parents and educators. This all helps kids have access to more nourishing food in their world. It's really a village, and I think we all play such an important role in this village. Public health is there every step of the way. All of these things really impact their wellness, and ultimately a child who is well can better reach their potential at home, with their family, at school, and in their community.
We continually invest in building strong relationships with schools and school boards to create healthy school environments right here in school communities. We work together with student leaders, school staff, and families to figure out what the needs are of each school and what actions to take to address those needs. Mental health continually rises to the top of the list. From creating school norms or running campaigns to hosting events, mindfulness sessions, or offering skill building opportunities to providing resources or supporting wellness subcommittees, Lakeland's Public Health is there working together with and empowering students and teachers and families to be mental health champions in their schools. We recently ran the Together for Healthy Schools initiative. So that was very exciting to have everyone together in one room to brainstorm and come up with ideas for ways that they can have a positive influence on mental health in their own schools. I'm proud to be both a community member and a health promoter with the schools team with Lakeland's Public Health.
I've always been interested in helping people. This was a career in which I can do it. Public health inspectors are prevention specialists working hard behind the scenes to ensure your food and coffee are safely handled, stored properly, and can be enjoyed in a clean environment. We not only inspect restaurants, we also investigate complaints, animal bites, and can act on potential health hazards in the community, like contaminated drinking water or recalls on food. Public health inspectors regularly conduct inspections at nail salons, hairdressers, recreational water facilities like public pools, public hot tubs, and also splash pads. So you can safely experience everything your community has to offer. And our inspectors work diligently to approve special event permits for your markets, festivals, and community gatherings. Wanted to kind of give back and make sure that the people in our community are safe. I'm proud to be both a member of this community and a public health inspector with Lakeland's Public Health.
We're all members of this community and we work hard to help this community thrive. Oral health is an important part of your overall health, especially as you age. Public health plays a big role in your well-being through several programs for seniors, including our community dental health clinic. For seniors who don't have dental benefits and may be living on a low income, we're here to offer almost all dental services in our clinic, including regular checkups, teeth cleaning, x-rays, restorative dental work, and even emergency services. If you need services beyond our clinic, we're there too. We have built strong relationships with local oral surgeons and denturists, so we can help you access every dental service you may need. Public health is there for you every step of the way. I'm proud to be both a member of this community and a dental assistant with Lakelands Public Health.
We're not separate from the communities we serve. We live here too. We're your neighbors, your friends, your family. What affects you affects us. It's work that protects entire communities today and for generations to come.
Nicely done.
This is done, yeah?
The whole night was like that.
I'm not gonna lose you to Paramount Studios or something.
This is Ashley, give Ashley the credit. Ashley and team, the comms team deserves a real,
Yeah,
we
we do, yeah, we did the math. That's, yeah, excellent.
The first time you go to a meeting and want autographs.
I know, it's gonna be asking for a autograph session. All right, so, any other questions on, Dr. Pritchett's report today?
Just one, if I could.
Yeah, Marilyn, yeah.
Thank you. It's great to hear that you have a pub in Peterborough. What about the other areas that we still have? We're gonna get that type of service, from that hub or for the other surrounding communities, or how does that work?
Geographically, I think they've, approved about 30 across the province now, something like that. So I think it's communities apply for the Heart Hub. I don't think they'd be refusing anybody from outside the Peterborough area, but, it's community-based, programming. So, each community, I think, has to submit an application to the province.
As I recall, we did submit one.
Right.
We did not.
We're successful. Yeah.
Not on Lindsay, Lindsay, did you get it on?
Yeah, we have a,
Heart Hub?
yeah.
Yeah, I think
Just
so.
opened, last week.
No, I don't think it's Heart Hub.
No, it's not a hard hub. We got a hub.
Yes, remember, yeah, you've got a shelter, that was just.
The shelter hub, sorry.
Sorry. Yeah.
The mixed up, sorry.
Yeah.
For those of us who are not aware of what, like, we wanted to get one in the area, like for instance, would be impossible to do one, but we could do maybe for the whole county, maybe Rainy Court, part of the Court of the Lakes, which is bordering on us. How do you do it? Like, who do you address? Where do you send it to? How do you start the whole process?
Yeah.
So, I mean, I'm speaking sort of secondhand because this isn't a program that's targeting public health program. Not targeting public health units. So there's no public health units that have led applications for the Heart Hubs across the province, is my knowledge. The organizations are generally mental health and addictions treatment agencies.
Okay.
So, for the 4 counties forecast, would be one to think about, and there's some other organizations might be eligible, but it'd be organizations that do mental health addictions treatment, permanent supportive housing, yeah, those kinds of pieces, but maybe we could, gather some information and circulate it to the board.
I think that would be great because if you do have a group of people that are really seriously concerned about it in their area, they could now find out and see if they could become a group, whatever that criteria would be needed. Just public knowledge, education.
Okay, I'm gonna go Ramesh and then Hans and then Councilor Joyce for your second time. Dr. McFeature, go ahead. You're on mute here.
Yes, can I speak now?
Yes, go ahead, Dr. McFeature.
Dr. Piggott, your report is very informative. And it will do very good to the community we live in. And the way you presented those posters and yeah, kind of information, it will enhance the public health image in the community. I recommend give you all the credit for it. Thank you.
Thank you, Dr. Peachin. Dr. Stelzer, I think you're next.
Yes, through you, Mr. Chair. Thank you again to Thomas for this very enlightening video. My question is more in relation to the older adulthood, where we mentioned support for dental care and so on. But the older patients, or I should say, the older population has many other issues, which I think might be appropriate for public health to be involved in as well. And I'm thinking particularly loneliness, proper food, some companionship, keeping appointments with healthcare providers and so on. Is there any role for public health to be involved at that level, given that our older population in Peterborough is probably, if not the highest, the second highest in the country?
Yeah, through you, Chair. Thanks for the question, Dr. Stelzer. So in the province, Lakeland's public health has the health unit has the oldest population in the province. I think the point that you're bringing up is an important one. There are a number of programs that do touch seniors. These great little videos were meant to be the start of explaining some, a selection of some of the work that we do, but doesn't come close to covering it all. We do other programming for seniors, including some of our health promotion and prevention work, some of our environmental health work, obviously vaccination program, among other things. But, noting the comments that you made, and I think one of the opportunities to think about how we better serve seniors is through the ongoing strategic plan and see what emerge as strategic priorities where there are things that we can do. I certainly think there are creative, interesting ways, especially even across generations, to connect people. And on the loneliness front, I do wonder about opportunities, even with the youth substance use prevention program, how we start to connect and help to build community across generations, because I don't think, a focus on just one program for different things necessarily works. I think there's opportunities to think about the full community. But thanks for the question. Happy to
thank you very much.
Okay, Councillor Joyce.
Yes, thank you, Chair. Sorry I misspoke on that. So in Lindsay, we have a community integrated care hub.
Yeah.
Might be a good stepping stone towards that, but I'm not sure. Centralize the services and wrap around supports. People can access what they need in one place, and basic things like showers, laundry, meals, safe overnight stays, connections with health and community supports, and really emphasize the wraparound services.
Mm-hmm.
So similar in getting people off the street.
Yeah.
And the doors open. You have to want it though.
Yeah.
Support.
Yeah, it's maintaining that connection. I think is the most important part of a lot of the CPS is we're losing a connection to the very vulnerable population right now. So thank you. The other questions? Forward clerk, sorry, yeah, go ahead.
Hi, sorry, I'm having problems here with my IT. I'm tablet, so I apologize. A couple of things too. The community paramedic program, which you can connect with as well. You do not have to have a referral through a healthcare professional. It could be yourself calling. And also the 211 number as well, utilizing that certainly. And the new pamphlet is coming out that gives all the connections of supports. I just seen a copy of it, and it should be available in all municipal offices, certainly here in Peterborough County. Now, I can't speak about the other counties, but that is a good resource, and I'm sure they do it as well. Are you aware of that, Thomas, at all?
Yeah, we've had conversations with them, and collaborations, but yeah, be happy to connect and learn a little bit more.
it goes through every like mental health where you get supports. It's just a whole directory. It's excellent.
Yeah, I think we're on there.
Okay, thank you.
Thank you, Warden. Councilor Riley?
Yeah, just one last thing, just picking up on the paramedics, our paramedic units in Palo County, they're starting to get involved with communal health in a much deeper way. From what I understand, and I'm not an expert on it, the province is more willing to work in that particular general direction. So our paramedic chief is now investigating what can be done, what funding is available. Is anything going to come out of it in the near future? Well, probably not for a couple or 3 months until we get some homework done. But we're kind of hoping that we'll have it ready for our upcoming budget for 2027. So.
If I just may add one more thing to that, it has just been moved, the funding from long-term care to under the Minister Jones portfolio. So I don't know what changes that will or won't have. So just be aware of that, Cecil, as well.
Thanks, Warden. All right, any other questions?
Just a reflection, I think what's really brilliant about the video is it's showing the life course, and I think what we're talking about is the need for more of these integrated wraparound models for the entire life course, right? And for different ages and stages, et cetera. But going back to the elderly population question, community paramedicine is one piece of it, looking at different models where you bring together long-term care with childcare spots is a great way to do multi-generational public spaces, bringing in other partners. Like here in Northumberland, we have community care that does food delivery. They know where some of the vulnerable public is. How do we connect those seniors that are still at home who are extraordinarily lonely? I know because I go around and I meet with them. How do we connect them to others when they have mobility issues where they can't go, for example, to a community center to engage in a seniors activity? They are the ones that I've forgotten. And yes, community paramedicine visits them once every 2 or 3 weeks, but that's hardly enough for those social connections to be maintained. So lots of challenges.
Yeah, thank you. Yeah, I'm just gonna do some shameful promotion here as well, as the topic of loneliness and integration comes up. I'm the president of a not-for-profit that's building Abbeyfield Lakefield. It's a 19-unit affordable seniors home in Lakefield. We've got a provincial grant, we've got our building permit, we're waiting for some federal funding to get the construction done, but we're ready to go. We've been working on it for about 5 years. But the integration piece, we have housing for Trent University master's students in social work or nursing or something like that. We have 2 spots for them to live there and do some research in the facility. So the whole idea behind Abbeyfield started post-Second World War with a lot of single individuals as a result of the war. Loneliness was the biggest issue for seniors. And so they have their own space within the building, but they have lunch and dinner together. And we have a community room within the facility that, again, because a lot of them have mobility issues and so on, transportation issues, most of them won't drive at the age of our residents. So we have a community room to bring those, keep them connected to the community as well. So there's about 20 of them in Canada right now. There's 4 in Ontario. We'll be the 5th. Again, just waiting for some federal funding from Build Canada Homes to move forward. We're ready to go.
There's one more question.
Oh, one more question. Gordon Clark.
Thank you. Can you hear me?
Yeah.
Okay, thank you. The other thing is community care, and they have wellness checks, and quite often the volunteers that are doing that do set up a relationship where then it becomes more than on the phone, it is a visit. So I think we need to have just a total assessment of what is out there as well, and have a coordinated approach so we don't try to reinvent the wheel.
Yeah, thanks, Gordon Clark. In Peterborough, they have Age Friendly Peterborough, which also has created a manual of all the services. It's in a hard copy as well as online, of course. So, so there is an Age Friendly Peterborough. I don't know if every community of a certain size would have that. I think it's provincially in some way. But there is one in Peterborough, and I sit on that as a representative of the county of Peterborough. So there is a book that's been created, that we can certainly look at and add to. All right, let's move on. We need a motion to receive Dr. Pickett's report for information. Mayor Vogel, Mr. Maloney, all of those in favor? And that's carried. All right, thank you. We'll move on to 7.1, Strategic and Emergency Services Division presentation. I believe Julie's gonna do that for the interim, and Dr. Pickett, you wanna?
Yeah, no, just,
Yeah,
thank you so much to Julie, our manager of emergency services and healthy improvements, who's gonna talk, about a really important topic, second leading cause of, lung cancer, which is radon. Some of the work we've been doing and possibly some of the work we could do, so over to you. Thanks, Julie, for being here.
Great. Thank you so much. Thanks for having me. So my name is Julie Bromley. I'm the manager of emergency services and health and environment under the Strategic and Emergency Services Division. Very glad to be here today.
Or click this slide.
Yeah, I'll just advance for you. Again, thanks for having me, and today I will just give a little bit of a brief overview of our current Strategic and Emergency Services Division. And then I'm going to focus on a very specific healthy environments initiative, and that's our radon. So next slide, please. Our Strategic and Emergency Services Division has several programs, as you can see up there, and if you would mind clicking 3 times for me. Our director is Donna Sherapy. Patty Fitzgerald manages health equity and community engagement, professional practice and health systems. And then I manage emergency services and healthy environments. So you can see our staff breakdown there. What's really fascinating about this division is it's very diverse. So we've got a lot of different specialties on our team. And we do have a couple of vacancies right now, but most of our programs are pan-organizational, so they intersect with all of the other divisions. And that's one thing that makes our work really next slide, please. And so from the Healthy Environment Standard and with the background of that division, I'm presenting on a special topic today from the Healthy Environments Program, and that's specifically our radon campaign. Directly from the Healthy Environment Standard, it says the Board of Health shall, as part of its strategy to reduce exposure to health hazards and promote healthy, natural and built environments, effectively communicate with the public by, and then there's some very specific language there. And one thing that is specifically mentioned is radon. And so there's lots of different environmental hazards. So why radon? And think about it. So radon is a very clear public health hazard. Radon gas is a product of the breakdown of some naturally occurring elements in our environment. It's dangerous because it's an invisible hazard. You can't see it, you can't smell it, and you can't taste it. But radon is the second leading cause of lung cancer overall, and it's the leading cause of lung cancer among people who don't smoke. What that translates to at a local level, when our amazing epidemiology team, I have to thank them for this data. In 2020, we had about 430 lung cancer cases and separately 255 lung cancer deaths. That's what was reported for the Lakelands area. In Ontario, the estimates suggest about 10% of lung cancer cases and 14% of lung cancer deaths are attributable to radon exposure. So what that equates to for the Lakelands public health catchment area is about 43 lung cancer cases and 35 deaths in 2020. You think about a Greyhound bus that carries, Greyhound, I'm dating myself, but 35 to 40 people. When you think about that number of people and deaths due to radon exposure every year, that is a little bit staggering. So these are population level estimates, and they might not reflect exact local exposure or individual risk, but just a picture. We'll go to the slide, please. What we do know about radon is that every home has some level of radon, but you have to test to know how much you actually have. There's different routes of entry into a home, and as we see more airtight construction, it creates conditions for radon to accumulate. If levels are elevated, mitigation may be required. There's different options for this, which I'll talk about, and the costs vary. They can be hundreds to thousands of dollars. And ideally, we want to be using certified professionals under the Canadian National Radon Proficiency Program. And those are the individuals who are best suited to mitigate elevated radon. We really do need to focus on educating people about this silent hazard in order to prevent exposure. When it comes to risk factors, smoking with exposure to radon creates a 1 in 3 people at risk for developing lung cancer, versus people who are exposed to radon only who don't smoke is 1 in 20. So when you smoke and you're exposed, your risk is exponentially greater. Children are at great risk as well. Organs are still developing, they have less body weight, and therefore overall higher exposure compared to adults. They breathe faster, they also have more life to live. Genetic mutations take time, and so there's more time for those mutations to happen. Next slide, please. The 2024 Cross Canada Radon Survey is where a lot of our information is pulled from. And from this survey, 99.7% of tests occurred between 2009 and 2024. Nationally, what we're seeing is 1 in 5 single detached residential buildings exceed the Health Canada limit of 200 becquerels per meter cubed. The Cross Canada study did specifically name Peterborough as one of the areas where more testing and data is needed. We also know that there is a greater risk for rural properties. So if we go to the next slide. Consistently overall, we see 30% higher radon exposure for rural communities. There's a few different reasons for that. Generally, there's more single detached homes than multi-unit dwellings and high-rise buildings. Generally as well, those single detached homes have larger floor plans and therefore larger footprints. When you see radon coming into a home, often through things like cracks and foundations and whatnot, the greater area can cause the greater entry point. Drilled wells are another factor. It's not the well itself, it's not the water, nor is it the casing, but it's that gap between the casing and the water. It almost acts like a straw, bringing that radon that's way down below, that radon gas 200 feet below, and bringing it up and creating a conduit into the house. So that can be another risk factor for rural dwellings. What I want to highlight is that both legacy public health units have been doing activities related to radon for years. Peterborough has had various approaches related to education awareness as well as test kit distribution. But in the Halliburton Report, the Pine Ridge Legacy Health Unit, the focus was primarily around education and awareness. So what we are seeing is that overall in our community, regardless of our efforts, we do still have a fairly low awareness of the risk of radon, and our work continues. When we were planning for what the 2025 and 2026 campaign could look like at Lakelands Public Health, we set 4 pillars to guide the campaign. We looked at organizational integration and integrity. So we brought Halliburton Court, the Pine Ridge into alignment with Peterborough. We had an opportunity to really pool our resources and level up the services that we were offering across the jurisdictions. What was really exciting, this was an early opportunity for harmonization. It fostered a lot of cross-functional teamwork between health protection, healthy environments, and communications. The second pillar we wanted to focus on, given the time that we started this was November 2025, was helping to enhance public trust and brand visibility. We looked at developing community partnerships, and we had the value add piece, which was we delivered and distributed free radon test kits to residents. We highlighted the role of the health unit and just an opportunity to showcase the Lakelands brand. When it came to community value and access, this is a really tangible prevention activity that connected residents with the health unit services. Was a value add for residents with a low to no barrier approach to distribution, and we had coordinated distribution to generate local data. That's the goal in the long term. And finally, we cannot underestimate the importance of partnerships and collaboration. We worked with municipalities, libraries, community health centers, and First Nation communities, and that's the foundation for ongoing collaboration. Just want to highlight that this map with the red dots is a little bit difficult to see, but the red dots are our distribution locations across the Lakelands catchment area. So we did try to have a fairly wide geospatial distribution site. And next slide, please. So what that equated to was 36 distribution sites in total. That was more than 36 distribution partners. We had a lot of phone calls and inquiries about this that our staff responded to. All 750 kits from the 2025 campaign have been deployed for distribution sites to the partner, and there's very few left to get into residents' hands. The researchers that we're working with have confirmed that 441 have consented and therefore theoretically picked up a device. But what that means is it doesn't mean they're not in people's hands. They just haven't done the online consent for the study yet. 346 have been registered, and that's a really great number according to the researchers. So we should be very pleased with what we're seeing. 73 have recently ended their tests, and so we're going to start to see data coming in soon. Overall, from 2024 to 2026, we've had 511 devices consented and registered with the National Radon Study. For a modest investment, we really are addressing a major environmental health risk, and we are looking to collect the data so that we can further mitigate that risk and encourage mitigation for people who are potentially exposed. Mitigation does happen to be at the owner's expense. There's very few supports for mitigation right now. You can go back for new home builds under Terry on Home Warranty for 7 years. There are some grants through the Lung Foundation that has one grant for people who do have lung cancer who are also exposed to radon, but this is definitely a gap in service. So while radon is invisible, our work is really helping to make sure that the risk isn't. Earlier in the presentation, I was talking about one of the value adds of the campaign. And it showed that it had positioned Lakelands as a proactive prevention-focused partner for community health. Just to highlight an example of that, unknown to us, in January of this year, there was a significant news story that was released through the National. And after hearing the story of this man who was diagnosed with stage 4 lung cancer, never smoked a day in his life, no exposure to secondhand smoke or anything like that. And it turns out that the likely factor is radon exposure in his own home. Well, my own mom called me and she said, Julie, have you heard the news? Did you see the news story? There's this really dangerous gas and we all need to know about it and we need to test for it. And I went on to educate my own mom with something that I've been working to educate the public with for 5 years. What was truly amazing though was that my mom was not the only resident who picked up on this story. We had this influx of calls and walk-ins to our offices and people looking for information, looking for test kits. And we had pre-positioned ourselves to say, yeah, we're Lakelands Public Health and we can help you with that. So that was a really, really excellent win at that point. So where do we go next? We really just need to keep the momentum going. That means we need to continue to invest in these types of campaigns. And eventually we need to move towards more upstream action, potentially looking at local policy interventions and mitigation funding. We have formed really excellent relationships with researchers based out of the University of Calgary. We get to be a part of the science behind this work. Upcoming in a couple of weeks, I'll be sharing our experience at another conference that I'm attending, and we have been invited to participate in the Ontario Radon Advisory Task Force, which is going to bring together interdisciplinary expertise to further talk about this issue. At the end of the day, as I've said, radon is invisible, but the risk doesn't have to be if we can keep our good work going. And that's all I have to be.
All right, thanks, Julie. Thanks for the presentation. Some questions. Ryan, we'll go to the screen first, and I think Deputy Mayor Richardson is first.
Thank you, and through you, Chair. Just a couple quick questions. Do we know if there's any hot spots in our region?
Yeah, through you, Chair. There's existing data that does, I don't know why I'm looking at the owl, sorry. There is existing data to show that we do have radon in our region. The actual displacement of that, we're still collecting that data. And that's one of the reasons that we really did push this campaign this year, is because we need more information. We're working towards a data sharing agreement with the researchers from the University of Calgary. So hopefully we'll know more as results start coming in.
Great, thank you. And just a follow up to that then, so what can be done to increase the testing in these undersampled areas?
Yeah, that's a really great question, and I think anything that we can do to continue the low barrier support to testing. So whether that's facilitating a free or subsidized radon test kits, promoting through education and awareness, there are municipal opportunities through the 100 Kit Radon Challenge as well, where municipalities can get access to 100 test kits. Those are not through the national study, but they still do help paint the full data picture across the province. So we just need to keep looking for it, and we need to keep testing for it, because to quote Taylor Swift, you don't know what you don't know, and we have to test.
Great, thank you.
All right, and Councillor Riel, you're next, and then Councillor LaChica, and then Ward Park.
Is there a radon detector, like we have a smoke detector, or?
Yeah, that's a great question. So there are short-term radon detectors that are digital. They're good in the sense that they can provide a snapshot, but there are so many considerations with respect to that snapshot. So how many people are coming and going from your house? Are the windows open? Are the doors open? So they're good for information, but ultimately the long-term test, 91 days or more, is the gold standard, because that's going to give a better picture of what's actually happening with the accumulation of radon in your home. We also recommend that if you're only doing 91 days, we recommend that happen over the winter months. That's why Take Action on Radon Month typically starts in November, so that we're getting that time period when the house is fully closed up.
Thank you. And Councillor LaChica.
Thank you very much, through you, Chair Black. Great to see everybody, and what an excellent presentation. I think it's just such an important campaign to be launching. So thank you for that foresight and vision for our region. I found it interesting about the 30% greater incidence of risk in rural in rural areas. So, and I just so I am clear, when you mention drilled wells, you know, we think of residences and cottages and so on. Drilled wells, are you saying that the gas emits with a greater frequency into those sorts of dwellings where there's a drilled well? Or like, I guess I'm just trying to understand a little bit better. If that's the reason the degree and the volume is greater in terms of the amount of radon that would be emitted because of the drilled well, it comes through the, you know, the pipes, the floor. Can you explain how that would work?
Yeah, that's a good question, and I'll do my best to explain, but I'd also be happy to circulate some more information from one of the researchers, Dr. Aaron Godarzi. He has an excellent answer to this. But drilled wells, when you go deep down into the surface, you know, drilled wells can be anywhere from 40 feet to hundreds of feet. So as you get deeper into the surface of the earth, you're actually hitting really deep sources of radon that is there because of the breakdown of some of the naturally occurring products that are in the soil. And so with that disruption, the drilled well actually provides a pathway that allows that radon-rich gas to migrate from deep within the ground and come up to the surface. Now, can you see my hands? If it just disperses to the surface, no big deal. It disperses to the environment. But what we can find happening is as you kind of come up through that pathway between the casing and the soil, there are then connections that go into the home. So it can follow those connections and the gas can get into the home that way. Also, as it comes up more towards that surface area of the soil, we get that gas intrusion through the soil. So it starts to migrate through the soil, and then you can have it further migrate into the house through foundational cracks in windows, things like that. So it's the well itself is acting more of a conduit to bring that gas from deep into the ground up. and then causing a greater risk factor. Does that help explain
Yep,
that?
that's helpful. It's a little more detail, but we don't need to worry about water tables and it emitting into lakes and the natural environment in the air. That's fine. It's within a closed dwelling unit that we're concerned. And so I would imagine then with the greater incidence, the 30% greater in rural areas, there would be a prioritizing of getting test kits to any hotspots in rural areas, of course, right?
I think that's probably a next phase that we need to look at, is working with our epidemiologists to sort of say what would be a better representative sample, assuming we can continue this type of campaign. Yeah.
Okay. Thank you very much for this. Appreciate it.
Councillor Warden Clark.
Thank you. And through the chair, Julie, great report, and to bring this to our attention. Joy has talked about the 30% because of the wells. Is there more of a problem as we see, droughts and the water table in our area? I've noted that drilled wells are getting deeper and deeper in order to have access to water for these private well systems. Is that a factor at all, or are you aware? The second thing is, you mentioned that as municipalities, we can we're accessible, I think it was 100 kits. Could you please tell us how we go about accessing those kits? And I may have missed this, I apologize because of my connection here
Okay, I think I have all of your questions. So, I mean, you're speaking to my other passion is climate change, and I think it's a great question. One of the adaptation measures is we may have to go deeper with our wells so that we have better secure water supply. As we're going deeper, are we creating more access to that deep radon gas? Probably. I don't have exact evidence and data on that, but I think it's logical to think that. But I think we also have to recognize that radon is not uniform. And so we don't necessarily know those exact hot spots. And so that's why testing inside the dwelling is really, really important. So it's twofold there. Yes, it could create greater risk. You don't know, you have to test inside the home. As for the 100 kit challenge, that is through Take Action on Radon. And so that is normally announced usually in the spring, and you apply for the fall. So I'm just looking, and it does look like applications for fall of 2026 are open. Maybe we can include the link to that. Can we follow up with the link to that? But if we just search for Take Action on Radon, you'll be able to find that fairly easily. And your third question was cost of a kit, I believe.
Yes.
Yeah, so that's also a great question. If you are individually purchasing a test kit, the long-term test kits are usually ranging from about $200 to $250, depending on the supplier that you're using. We do encourage people to participate in the National Evict Radon Study so that that information can be collected and we can make better decisions for our region.
Thank you. Anybody? Councillor Rael? Mayor Lowe.
And for those of you who may not know a whole lot of history about Haliburton County, we have a small town in there called Cardiff. And Cardiff is a corporate town, or was a corporate town. And its existence was related directly to uranium mining. That is the main thing that happened for quite a few years. So I am deeply interested in finding out more about that. Why? Because cottage cheese is starting to come. And it's extremely important. We've had a lot of turnover in cottagers from what was to what is. And so the education piece is extremely needed. And the other thing, if I'm mistaken, I'm certainly going to get corrected. Everybody's heard of what an aquifer is, but there's also a radon-fer, which is equivalent in its way it works. The earth, in her very nature, cracks and does all kinds of great, wonderful things, and radon flows through those cracks. And so even though the radon or the mine per se was in one locale, it's not impossible for 3 or 4 kilometers away from that or more for radon to show its face. It really depends on what movement has taken place and how it's gone. So if you have any information, I definitely, and I will speak now for I'm not sure about all of Halliburton County, but certainly the eastern portion. We would be deeply interested in knowing, because we're old and it affects older people as well. And cottagers now are no longer cottaging. They're moving here, they're living here. And so what wasn't a problem before is a problem now. So maybe after the meeting, we could talk and I'll get more information from you. I realize what you have is limited, but whatever you have is more than we have.
Logo?
Julie, thank you very much. It's an excellent presentation. Really enjoyed it. My question is regarding the testing the locations. Did we ever look at schools and social retirement homes and that type of stuff?
Thank you for the question, through you, Chair. Not specifically as Lakeland's Public Health, we haven't. We have been focusing primarily on residential. One of the reasons being exposure risk factor is based on the amount of radon in the home and the time that you're exposed to it. If we were going to look at a more facility-based testing campaign or program, what I can say is that some other public health units across the province have actually started to look at daycare facilities. And that would be one that I would personally be interested in. As I mentioned, being a young child is an additional risk factor because they are still developing, their organs are still developing, they have higher respiratory rates. So in theory, they could have a higher exposure dose. And so I think schools could be important and other facilities definitely would always encourage the testing there, but daycares would be one I would particularly look at.
And my follow-up was trying to deal with the time and the distance or the quantity of exposure. If you're getting out of the home to go to work or whatever, you're much less likely to be exposed. Is that correct?
Your exposure is going to be reduced if you're not spending as much time in that environment. Absolutely. One of our societal movements that we're seeing now is hybrid work and work from home. So sometimes people are actually getting more exposure. And so we used to, 5 years ago, 6 years ago, we would say test in the lowest level of your home, regardless of where that was. But now we've sort of changed that messaging to say, test in the lowest level of your home where you spend on average at least 4 hours a day. Could be your basement, could be a different level of your home. But you're right, if you are getting away from that, then your exposure is going to be less. Doesn't mean that you shouldn't mitigate if you do have those elevated levels though.
And is there a rate that says this is where you're going? I guess I didn't see it. There is an exposure level that's too high.
Yeah, so Health Canada's their exposure level or indoor concentration of radon that is acceptable is up to 200 becquerels per meter cubed. So if you test above that, mitigation is recommended immediately, or within the first year from 200 to 400 and then immediately after 400. So there is some guidance around that. Yes.
Thank you.
Councillor Joyce, thank you.
Thank you, Chair, through you, and it's a great presentation. I've got 2 comments, 2 questions. First one is, I went through your presentation earlier today, and I've been working from home since 2022 in a ranch style, big footprint, single story house. I'm gonna get a radon test. Okay, so that's my first comment.
Today, thank you.
Question is, I'm looking at your map for the locations in Fourth Lakes. Did you talk to our library people at all?
Yeah, so actually in City of Port Lakes, the library partners were our primary partners for distribution sites.
Yeah.
And then second to that, we worked with some of the community health clinics and some partners who do smoking cessation as well.
Okay, my understanding, we have 14 branches. Any branch will supply a kit, but I think what they do is they probably move them around.
Yeah, so we worked particularly with the library board, and then they sort of disperse them to different locations. I don't have the branches in front of me. I can get you that information, but it was dispersed.
You probably know this. My other question here is with the libraries, I know they're free. Are they a returnable kit? Like, do you keep them just for one day? Do you keep them for 91 days? I really don't know from our own library system how that works, and if you can answer that question.
Yeah, I can, for sure. So, we're sort of talking about two things. One are the supply of kits that Lakeland's Public Health provided to distribution partners, including the libraries.
Yeah.
Those kits are a long-term test kit. So residents were able to pick one of those up free of charge, consent to the study. They set it up for at least 91 days. There's a whole back end process. There's a prepaid postage envelope that gets sent back to the lab where that gets analyzed. So not a returnable kit. So those are the long-term tests that public health has supported. What is also available at many of our local public libraries in the Lakelands catchment area are short-term tests. So they're more of a digital unit, and that's sort of what I was speaking to earlier. They're great and it's a great indicator, but it will not give you the full picture. So it's an excellent indicator, something that we definitely would encourage libraries to look at. If you have a lending program, we can support that with additional public health information, but the long-term testing is the gold standard.
Thank you. Sorry, Chair, I got a couple more questions that just came to mind when I got there.
All right.
This presentation you're doing is wonderful. Do this presentation to other groups, is that part of your job, or, and I don't know how that. Right, I mean, emergency services, maybe you can just expand upon that. I'm just imagining you have a pager, you're a first responder, as soon as I see emergency service. How does that, what do you know?
Oh, you say pager and I cringe from on-call days. No, it's a great question. And I think that's one of the fascinating things that I absolutely love about my portfolio is because it is so diverse. Today, for example, I started at my home in the city of Peterborough, drove through Peterborough County into city of Kawartha Lakes to then go into Haliburton County to support Minden Hills with their state of emergency, to then backtrack and come into Northumberland County. So all 5 major jurisdictions in one day. So as emergency services, I do a lot of, and I say I want to recognize it's the team. The team does a lot of planning, preparation. We support municipalities when they go in emergency response.
So there's an emergency response, you're there.
Yeah, yep, exactly. So this program is under a little bit of a different part, and that's the healthy environments component. And so this is part of an environmental health initiative that sort of touches on in Thomas's video when he mentioned about the 2 branches. We have protection and promotion. This is really cool because it's both of those. So it's a healtly environments initiative.
Okay, so my last question, thank you, my last question, right?
Is your last question?
Oh,
Pressing the chair here.
Would it be appropriate for Manager Brawley to come to council to do a presentation?
Oh, that's what I was
Get the
gonna,
word out.
Absolutely.
same question.
Okay,
Question.
Same question, yeah.
thank you.
Karen Kiske.
So I'm just wondering, you know, of our little problem here for patient, right? Part of it, of course, is radon testing in homes, right? So I'm wondering, is there an opportunity to connect that data that's been collected here for years into some of these studies that are being undertaken? It seems like that dot should be connected somehow.
Yeah.
And sorry, and also just that these testing abilities already exist within our municipality, and so how do we get the word out? Lots of homes have already been tested here. In fact, probably somewhere in the neighborhood of 12 to 1400 in our community have tested for low level radioactive waste. I'm not sure which percentage of them would have also had radon testing in the homes, but it seems like it would be a fairly high end, and I think somehow that data should be combined and collected. And if the testing kits are here, maybe there's a real opportunity to up a pilot here in the community because kits are already here.
Yeah, that's a really interesting connection. Thank you for that. I personally don't know enough about the Port Hope Initiative and the existing testing that's been done and who that's been done for. So I would have to look into that further and then talk to the researchers to see if there's any opportunity to connect the data.
Canadian Nuclear Labs, right? CNR. They're
Okay.
ones that are.
Yeah, and I mean, we have connections with the CNSC, so we can certainly touch base with them and see if there is a bank of data. And if any of it can be used for the national study, I will take that. Yeah.
All right, just as show of hands, who has done the radon thing? Anybody online? No, I guess we're teachers pet, clearly.
But
It
not
was-
the last 5 years, which is,
Oh.
I know it's since renovations.
So it's time.
Yeah, I did go to Lakefield for the presentation last year sometime. It is very simple. They give you the kit, go online, register the kit with the number that's on the thing. They keep reminding you to, they should tell you where to put it. They give you directions on kind of where to put it in the house, the best place to put it. And then you'll get reminder emails after the 91 days. Can you please return it? Can you please return it? Can you please return it? So on the third request, you go down to the basement and find it and put it back in the envelope and send it off. And a couple weeks later, you get your results. So it isn't complicated at all. They made it really quite easy to get it. So anyways, thank you. Wonderful presentation. All right, thank you. So let's get a motion to receive Julie's presentation today for information. Get some motions here. We've got Councillor Real and Councillor La Chica. All those in favor? That's carried. Thank you. All right, we move on to item 8, which is consent items. 8.1 is the minutes from the Indigenous Health Advisory Circle. 8.2 is stewardship, and has a couple of motions there, and then the correspondence for information is 3, and 4 is the banking information that we've been working through to get the organization up to speed on banking. So, and then item 5 is Alpha membership fees. So does anybody want any of those consent items pulled for discussion? Which one, Mr. Norman?
8.4.
Okay,
and 8.5.
8.4 and 8.5. Councilor Joyce?
I just have a quick thing on the stewardship.
Okay. So we will start with 8.2. Anybody else? Not seeing any. Let's start with 8.2. Hey, Councilor.
Just the links weren't working, so I couldn't read the financial reports or anything.
Oh.
So if I could get those post meeting, it would be wonderful.
Oh, okay.
Maybe it's just me.
Minutes.
We're just minutes at this point.
No, there's a
You should just hyperlink to later in.
2025 quarterly finance report.
That would have already come forward, but it might have been a dormant link that was in the report, but that quarterly report became.
That's all I was saying.
Okay.
Thank you.
I'm clicking on it and it wasn't getting.
Thanks for letting me know.
All right. And we will go to 8.4, which is the banking information.
Yes, through you, Chair. Just reading this over, I'm not in disagreement with anything. I'm just curious on the amounts. Is there reasoning or rationale behind why we're choosing these amounts? Is there a standard procedure from the ministry that we should follow in terms of, you know, just 1.8? I did read it was maybe some historical reference, but like, why not 2? Why not 1? And then same with the credit card and that kind of stuff. Thank you.
Okay, let me take that over.
Yeah, thanks for the question, through you, Chair. The amount is the legacy amount. We didn't do a review this time to see whether we should change the amount. Particularly because, as noted in the report, we have carried these line of credits for many, many years and never actually had to access them. They're there to satisfy if we had a cash flow issue. Some health units experienced that through COVID because it took a long time for the ministry to flow money to health units. But even during that time, both legacy health units did not need to access their line of credit because of the reserves they have available to them. So we felt it was adequate to leave it where it is. If the board is interested in a more fulsome review, we can certainly look at that. But that's why it is where it is.
For you, Chair, follow.
Yep.
I would be in favor of that just because, you know, through the media and through other organizations provincially funded, we are seeing big deficits. And, you know, we don't know where we're headed exactly. It would be nice to know what we should get in terms of coverage, right? Again, it's just insurance to make sure that we can be prepared, worst case scenario, but it would be good to know where we fall in line with what the ministry suggests, maybe what other health units should have in place. Is it 1.8? Is it 3? What's that number, right? And same with the credit card. So it would be good to know if it's not too much work. That'd be something to come back with, but I think would be great.
And Dr. Pickett, I think.
I was just going to inquire, Mr. Maloney, if you're thinking whether it's adequate, like high enough, I wonder whether we could approve the motion as presented and add an amendment that, you know, with adequate time, we would take back a review. Just so that we stabilize.
Do it all at once.
Well, yeah, my thinking is if we can approve the legacy amounts, which we probably could have done earlier last year, but we've been trying to integrate it and it's taken this long to get here. Then at least we have in place what we used to have, which we don't currently because we haven't reviewed and approved this, and RBC didn't just roll over, they needed new approval from the board on the legacy amounts. And then maybe we would add a motion that would direct staff to conduct a review on those amounts and then bring that back to the board.
That work for you?
Yeah.
So, great. So adding a point to this motion to direct staff to do a review. Yeah, Councillor,
Just wondering if this is something, once the review's been completed, is this something that should be reviewed by the stewardship committee prior to coming to the board?
yeah.
So I think you should minute so that it comes before the stewardship committee first and then comes to the board.
Yeah, okay, got it, yeah. And Warden Clark, go ahead.
Yes, thank you. And I was going to ask about that because when you look at the table, there's several with 10%. And certainly 5 is at the lower end of the scale. So I look forward to that report. My other question is, with these reserves, are we restricted on how we can invest them?
Restrictions in investment. I think there's two things here, Warden Clark. One is the reinvestment. One is the reserve fund, and the other one is the this is just the overdraft protection that we have for our current account.
Yeah, sorry, I realize I'm dipping into both. I was just curious. Yeah, this is kind of our insurance policies here is what I think if we get into trouble, but I was just curious about our other funds, whether
the reserves.
Yeah.
Okay.
Question is whether we should invest reserve.
Invest reserve, what's our policy on investment of reserve funds?
We're not limited in terms of being able to invest our reserves. But we would take the cautious approach to that. We have looked recently at investment opportunities that would be more secure, and they're actually not that much different than what the banks are providing for us. So we haven't done so.
Okay, thank you.
Yeah. Mayor Kirsty, go ahead.
Just on that point, I wonder if the public health unit is, if you can invest in the same thing that municipalities now are considering, which is beyond traditional using vehicles to something called fund investment now, which allows for other options that traditionally have not been investment vehicles for municipalities. And the returns are a lot stronger, and there's a growing group of municipalities across the province that have invested into that investment.
Yeah, reserve investment's been a huge benefit for municipalities in the last 5 years, for sure. Dr. Seltzer, go ahead. Yeah.
Through you, Mr. Chair. I don't have the document in front of me and I'm reluctant to go back to it because I might disconnect myself, but I remember that discussing the use of the reserves, there's a statement that says the reserves can be replenished from unspent municipal funds or annual operating surpluses. And I'm just wondering, where do these surpluses come from and what funds are not being spent?
Yeah, okay.
Kind of way off topic, aren't we, in terms of?
A little bit, yeah. We're getting a little bit further off topic here, but yeah, we'll discuss the stewardship. But go ahead.
Yeah, so it was, in terms of our ministry funds that we receive for program delivery, any surplus would go back to the ministry. But because it's a cost shared basis, any municipal funds that are part of the surplus can be retained and put into a reserve. So that's where the majority of our reserve has come from municipal funds.
Okay, so in other words, the municipality does have surpluses that they can part with to our benefit. I mean, I thought we were all under financial pressure, so I guess that's my lack of understanding of the surpluses that we somehow have. I mean, municipalities are always struggling with the tax problems, as everybody else is, and we're always struggling with our long-term debt and so on. I just can't believe that there surpluses exist that will replenish our reserves once we use them up.
Yeah, maybe we can take this one offline. Dr. Stelter, I think
Okay.
the money is unspent. The municipalities are asked for a certain dollar each year that comes into our budget. If we have gap positions and we don't happen to spend all that money, then that's the little bit, it's not a lot.
None was unspent last.
None was unspent last year. So it is, there's nominal amounts sometimes year to year, and it's been going into reserves in both health units at this point. But because we ask for a certain dollar amount from the municipalities that comes to us, if there's any surplus, it doesn't go back to the municipality, it goes into the reserve.
Okay,
If we don't.
thank you.
Okay, all right. Any other questions on 8.4? Let's move to 8.5, which is the Alpha membership fees. Anybody?
I brought it up, yeah.
I'm sorry, yeah.
Yep, through you, Chair. Just struggling again with value here. We've had this conversation.
Yeah.
I believe post-merger and pre-merger. Happy to see they didn't just pile them both on.
Yeah.
25 grand plus. Content with 21, and I don't know what to do besides just say I'm not happy with it, because I'm just seeing very little value. And I know we've brought this forward, and it was actually a little tough to get information out of them in terms of what they do provide. I don't know if it's worthwhile getting that run again. I don't know if I necessarily know, or if there's a feeling for just wanting to turn this down. I don't think we're there yet, but I feel like I'm getting closer to it, because I just don't feel we're getting a tremendous amount of value for, we have a discussion about a line of credit that could potentially be used, and then we have a $21,000 bill that I'm just not seeing the value in. So not that there's a lot of questions there, unless someone wants to speak to value, but I'm just not seeing what we should potentially be getting out of it. Thank you.
I will speak to that. You're right. I mean, we've had some very candid conversations with the Alpha board, spoken to the president of the board as well, the chair of the board rather, sorry. And it is challenging. The organization mostly works on advocacy around programming, those sorts of things. Almost no advocacy around funding, which is my concern. It is a lot of money. We are trying to do as much advocacy on our own around the funding piece, specifically post-merger funding is a big concern still for us, obviously. But we have to get engaged at the annual conference to bring these points forward. We have been a bit of a thorn, this organization that prior Peterborough, as you were on the board back then, brought it forward. And we've made our case to them that we need them to be more than what they are today for the amount of money that we're spending. So I'm unable to make the meeting in June. I'm going to be away on a holiday. So I'm looking for somebody from our board to go to the meeting and do that advocacy for us, that Alpha needs to do more than advocate on policy, that sort of thing. They need to advocate on making sure we get more than 1% funding and 6% over the last 10 years. So I don't disagree with you. I think there's work to be done, and that time may come that you speak about at some point, but I think we have to do some work first and then decide. Mayor Hankinski?
What is the date?
June 8th to 10th. June 8th to 10th. I'm away till the 12th, so.
I can find out the exact day of the HEM.
Yeah. Yeah, it's been circulated once, but if you can, we can get one or two of us to go. Recirculate them. Yeah, I did did some work last year on it, quite a bit. They know who I am, they know who we are. But unfortunately, fortunately for me, I'm gonna be away on a nice trip, but unfortunately, I'm not able to make it to it. Mayor Clark, sorry, Warren Clark, Warren Clark.
Thank you. And to you, Ron, just curious on how many health units, what is the percentage that are members?
100%. Right, 100%, yeah. Everybody's a member. It's the range of fees goes from 6 figures down to ours. We're considered a low medium size. We did finally get the actual formula they use. They initially wouldn't even provide us the formula. We did manage to get that to say that, okay, that is a fair number based on the way they worked it to some degree, but
No,
yeah.
Thank you, because I know you did a lot of work to get this lowered.
Yeah.
From what, and so I want to recognize that. I certainly, you know, feel the same way. What bang for the buck are we getting here? So anyway, yeah, thank you for that. And I was just curious if there was anyone throughout the province feeling and voicing their concerns like we are. So thank you.
Yeah, thank you. Yeah, no, I think there's still work to be done, but we may make that hard decision at some point.
Okay.
Thank you. Anybody else on item 5.5? No? Okay, so let's receive 8.1, 8.2, 8.3, and 8.5 as presented.
I'll move that, Ron.
Thank you, Warren Clark and Mayor Logal, seconded. All in favor? That's carried. Now we're going to do 8.4 as a separate motion because we have an addition to the motion. Can you maybe read the addition?
The addition was to direct staff to conduct a review on the amounts and bring them back to the stewardship committee and then to the floor.
Yeah, okay. Oh, there's no, we're gonna move
We'll
it.
make it, yeah.
Okay, move a seconder. Anybody up there? Yeah, Dr. Stelzer, yeah? All in favor? That's carried, thank you. All right, any new business any member wants to bring forward tonight? Not on the agenda. Don't see any hands, thank you. All right, we're going to move into the in-camera session, so we'll have a bit of a break here. So I need a motion to go into in-camera. Mayor Hankins-Sissy, and sorry, and Mr. Maloney. All in favor? Okay, we're gonna take a couple of minutes to move in camera.